Good, happy Wednesday morning, May 19, 2021. I'm Riley King, and welcome to this Wednesday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Wednesday morning, so let's begin. First step, New Hampshire to end federal pandemic unemployment benefits offers bonus to those who return to work. Sununu says unemployment low, but 15,000 fewer employed in state compared to before the pandemic. Let's take a listen to that video from WMUR News 9.
A lot goes into taking care of your property. You need equipment with more reliability, durability, and versatility built in. Like #1 selling Kubota compact tractors that can do it all right. Z-Series mowers that deliver a quality cut. And the Sidekick utility vehicle built for hard work and fun at 40 miles per hour. Kubota equipment lives up to the highest standards. Yours. Visit your local dealer today.
Chapel Tractor.
The unemployment rate in the state is now at 2.8%, down from the pandemic high of 16%. So the state will end extra federal benefits on June 19th and spend $10 million of federal relief funds on back-to-work bonuses, $500 for part-time jobs, $1,000 for full-time. The job cannot pay more than $25 an hour. About 35,000 people on unemployment are eligible.
Now we're kind of reversing course a little bit in a very positive way and adding a stipend, an incentive to get folks back to work.
After the first, March 15th, laid off, the industry just shut. And it still is to this day.
Newborn photographers Christine and Jonathan McIntyre lost their full-time jobs at hospitals. They say his benefits are tied up in Massachusetts. She's receiving $168 a week from the state, plus the federal $300 boost. With 2 daughters at home, they don't want to apply for temporary jobs out of their field.
Probably not fair to the employer, too. Hi, can I work here for 1 to 3 months?
And some question a back-to-work bonus.
The benefit should be earning a paycheck to support their lifestyle. Something that I think would have gone over a little bit better is really rewarding those people that have worked throughout the pandemic.
Once people work 8 weeks, they can apply for the bonus, available until the $10 million federal dollars run out. Jean Mackin, WMUR News 9.
And we do have new statistics now for New Hampshire. Active cases of COVID-19 are down by half since the first of the month. Today, the state reported 139 new cases and 1 new death not linked to a long-term care facility. The state also says 5 deaths from January and April have just been linked to the virus. Health officials say the 7-day averages for both daily new cases and the positivity rate are dropping.
Okay, and there you go on that video and that report. State epidemiologist recommends people continuing to wear masks indoors. Let's take a listen to that video from WMUR News 9.
For the easy and the complex, the small stuff and the big, we're here with the affordable local loans, easy to manage accounts, and financial advice to help you blaze a trail, figure stuff out, and make your money go farther. We're Granite State Credit Union. Live bold.
We are recommending a slightly different approach from what CDC has recommended.
New Hampshire State epidemiologist Dr. Benjamin Chan announcing today the state is recommending everyone, regardless of their vaccination status, wear a mask and socially distance indoors when around people who are not vaccinated or their status is unknown. That differs from the CDC's most recent guidance, saying vaccinated people can go without masks and social distancing in most areas.
Continued use of face masks and social distancing in these higher risk indoor settings is going to help us exit the pandemic more quickly.
Dr. Chan also cited adjusting for New Hampshire's current vaccination and infection rate, protecting those who can't get the vaccine, allowing more time for others to get vaccinated, and helping businesses navigate in a who is and who isn't vaccinated world.
The CDC guidance was difficult, if not impossible, for businesses and organizations to figure out how to implement.
Governor Sununu says businesses need to make the best decisions for their unique dynamics, and for those concerned others will go out unvaccinated and unmasked, he says the vaccine is the best way to protect yourself.
I get you want to make sure and hopefully be in a situation where you're the most comfortable, but folks shouldn't be walking the streets worried about whether the next person next to them is vaccinated or not. You've had that option for yourself. You've had it for quite some time, and you can take those mitigation measures for you and your family if you can choose.
Now, Dr. Chan calls this a transitionary measure. He says the ultimate goal is to have the vaccine control the pandemic. In Concord, Jessica Moran, WMUR News 9.
Okay, and there you go on that video and that report. One new COVID-19 death confirmed in New Hampshire. Cases continue to drop. Let's take a listen to that video from WMUR News 9.
The National Fire Protection Association says you should get your chimney inspected and cleaned every year. Caesar.
Thank you and good afternoon. So today we are reporting 139 new people diagnosed with COVID-19. Our daily incidence of disease continues to decrease. In the last week, we have averaged about 150 new people diagnosed with COVID-19 each day. And currently, there are 1,118 people with active or current infection. Our test positivity rate, that's the percentage of all tests that are positive for COVID-19, also continues to slowly decline. Over the last 7 days, our 7-day average test positivity is now below 3% at around 2.9%. Hospitalizations also continue to decrease. There are 48 people currently hospitalized statewide with COVID-19, which is a decrease from last week. And then, unfortunately, one new person to report who has died related to COVID-19 this week or in the last week, in the last day, bringing the total number of people who have died from COVID-19 during this pandemic to 1,334 total deaths. This individual was not associated with a long-term care facility, and the high vaccination rates in our long-term care facility population has prevented more disease and deaths. Over the next several weeks, especially as we look to transition to relying on vaccination for pandemic control and to keep everybody safe, I want to continue to strongly recommend and encourage everybody who hasn't already taken advantage of the opportunity and the appointments that are out there to sign up for an appointment, to get vaccinated. If you've gotten one dose of the Pfizer or the Moderna vaccine, you need 2 doses to be fully vaccinated. If you've been previously infected with COVID-19, it's important still for those individuals to be vaccinated as well. Vaccination produces higher levels of protection and longer lasting protection, and vaccination is where we need to be moving in this pandemic so we can transition to a more normal societal functioning. With that, I will hand things over to Dr. Daly for vaccine update. Thanks.
Great. Well, good afternoon, everyone. I have a few quick updates for you on vaccines. To date in New Hampshire, we have administered 1,310,000 doses of vaccine. This includes 765,000 people that have received 1 or more doses. That's 56% of the total New Hampshire population. And then 593,000 people have been fully vaccinated, which is now 44% of the population. Last week, the Pfizer vaccine was approved and recommended for use in children 12 to 15 years old. So far, we have had around 5,000 children in that age group get their first dose of vaccine. We encourage all parents to get their child 12 and older vaccinated. And there are 3 ways that children can get vaccinated. This includes registering in Vinnie to be vaccinated at clinics across the state, or by getting vaccinated at a school-based clinic if your school is offering one, or through your healthcare provider if your healthcare provider has vaccine to offer their patients. And we are starting to provide those vaccines out to the provider community as we're able to. When registering in Vinny for your child, be sure to pick one of the locations that is on the list offering Pfizer vaccine specifically. And as a reminder, you can now walk in to one of our state-run vaccination sites and get vaccinated without an appointment between 3 p.m. and 6 p.m. each day except for Sundays. Yesterday was our first day of offering these walk-in appointments, and more than 250 people took advantage of this really great opportunity. So we encourage all parents to make that choice to get their child vaccinated through one of those different opportunities. And then lastly, I just wanted to remind you that along with Elliott Health System, we are hosting a vaccination clinic for people who are deaf or hard of hearing and their family members and caretakers. This clinic will be held on Saturday, May 22nd in Manchester, and we'll have on-site ASL interpreters. Appointments are required, so you need to contact us to sign up by May 19th. You can do that by video phone. The numbers here are on this slide, 603-546-7882, voice at 603-271-9097, and then email at equityvaccine@dhhs.nh.gov. At this point, about 68% of people in New Hampshire who are age eligible have already made that choice to get vaccinated, and we hope you will too if you have not already. Thank you.
Good afternoon. Outbreak update. We have no new outbreaks. We have no outbreaks to close. We are still at 2 institutional outbreaks, one at the Federal Correctional Institute in Berlin and one at Sullivan County Healthcare. Our homebound program is on track to be completed at the end of May. Thank you.
Okay, and there you go on that video and that report. Performing art venues prepare to get back in business. Take a look at this article. And if you want to read this again, we will share it with you on the Riley King Network Facebook page after the broadcast. New Hampshire lawmakers consider amendment to ban mandating COVID-19 vaccine. Let's take a listen to that video from WMUR News 9.
The past year has tested the toughness of every last one of us. We had to retract our...
Rep. Terry Roy says he sponsored the amendment at the request of constituents.
It's, in my mind, reprehensible to the Constitution. It just does not jive. We cannot make excuses to take people's bodily autonomy away from them.
Part of the proposed amendment would keep employers and K-12 schools from mandating the vaccine and also inquiring as to whether employees or students are vaccinated. Dr. Beth Daly of the Department of Health and Human Services says there are about 300 deaths per day in the U.S. from COVID. Prior to the vaccine, that number was around 3,000. She's concerned the amendment could have farther-reaching effects beyond just the COVID vaccine.
Vaccine requirements are essential to the health and safety of our communities. Letting children attend school without regard to vaccination status will set us back over 100 years before we had safe and effective vaccines.
The New Hampshire Hospital Association concerned of the effect the amendment could have on public health.
Hospitals care for sick people, including those that have contracted COVID-19. They must ensure that their staff, their patients, and others that enter the hospital are always safe. The amendment does not address public safety and public health.
Others say it will provide people with protections and could help with vaccine hesitancy.
The solution to these ideas of vaccine hesitancy is actually to respect individual choices.
We need this because it protects people from discrimination in goods, services, houses, employment, education, and places of public accommodation based on vaccination or immunity status.
No vote was made on the amendment today. Charisse LeClaire, WMUR News.
Okay, and there you go on that video and that report. Arrest made in Franklin shooting. Police search for another person of interest. Let's take a listen to that video from WMUR News 9.
To be a part of the team at Caesar Chimney Service, the only prerequisite is be just a little bit crazy. We can train you to do everything.
Good afternoon, Sean. This allegedly began on Elkin Street, which is not far from the police station. It then escalated into shootings at 2 locations, and police say they also had to deal with some troubling rumors. Now, according to Franklin police, the first shots were fired into a home at the corner of Prospect and Pine Streets in Franklin. Police say they have arrested Rayshawn Hubbard and charged him with firing those shots. The second incident happened at an intersection on Pleasant Street, just a couple of blocks removed from the first shooting. That second incident did injure one person who was taken to Concord Hospital.
We believe it was a shotgun with buckshot. My understanding was he was supposed to go through surgery this morning to remove some of the pellets. We have been told that it's non-life-threatening. I was taken aside during the initial investigation and told that people believe this to be a police-involved shooting. It was not. Unequivocally, no.
Now, police say that one thing that's been very helpful in this investigation is that some people have home security camera footage that they are sharing with police, so they do have pictures of the incidents. There is still another person of interest that they are looking for. They're not sure if that person of interest is still in this area, so police are saying that if you spot something that doesn't look right, give them a call immediately. Reporting live in Franklin, Ray Brewer, WMUR News.
Okay, and there you go on that video and that report. "11-year-old girl fights off would-be kidnapper." Let's take a listen to that video from NBC News.
Great Create is a show that celebrates the influence of the creator. Each episode will explore
Okay, and
hey, NBC News viewers, thanks for checking out our YouTube.
There you go on that video. And thank you for joining us for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. Goodbye, everyone.